see you. Thank you very much.
Hi, I'm Riyadul Karim, and I'm here today in a North London GP surgery to talk about the important issue of measles. So, Dr. Miah, why is measles so serious?
Measles is serious because it can spread extremely quickly in an unvaccinated population. So it can spread by coughing, sneezing, or just by breathing. If we compare how infectious it is in this population compared to something like COVID, if you remember when we were going into lockdowns, the government was quoting the R number, the reproduction number for COVID at those lockdowns was at best 2 or 3. The comparative data for measles is showing us that actually the R number for measles is 15. So it's very, very infectious. And of course, this can lead to outbreaks very, very easily, especially where the vaccination uptake is low. A simple, straightforward infection of measles can make a child very unwell with high temperatures, a really bad cough for up to 2 weeks, sore eyes, as well as a rash. And the important thing to note about the rash is the rash can look different in darker skin. So if you are at all concerned that your child may have a rash that may resemble measles, please book in and call your GP practice. And it may be easier in some children to see this type of rash or particular spots inside the mouth or on the underside of the eyelids. The important thing about measles as well is unfortunately there is no cure, and it can also affect your unborn baby should you contract it whilst you are pregnant.
Thanks, really interesting, very insightful actually. Can I ask you another question about, are there any long-term dangers in catching measles?
The problem with measles is not only is it a horrible infection to have when you first contract it, it can actually affect different parts of the body with the infection, and this can lead to other complications such as seizures, blindness, pneumonia, as well as encephalitis. And something else that measles unfortunately can cause as well is inflammation of the nervous system itself, which does not show itself for many years after the initial infection, and this can actually be fatal. What we've also seen after a measles infection is it can affect your immune system and leave you vulnerable to other simpler infections that our immune system had become well versed in fighting off. This effect can last for up to 3 years after the initial infection. And so what I mean by this is from childhood into when we get older, our immune system recognises simple coughs and colds and viruses in the environment and is able to fight this off effectively. However, after a measles infection, there is research to show that actually our immune system isn't able to do this as well, so that you're actually more vulnerable for that time period.
What can you tell us about the MMR vaccine?
The measles vaccine is administered in a 3-in-1 vaccine, which protects against measles, mumps and rubella. In order to be fully vaccinated for the measles, you need 2 doses, and the 2 doses are administered at the ages of 12 months and then at 3 years and 4 months. After the full vaccination, it is 99% effective against measles and rubella and 88% effective against mumps. However, anybody can catch up with the vaccination schedule at any stage of their life.
Thanks again, Dr. Miah. Should someone have the MMR vaccine if they want to get pregnant?
So having the MMR vaccine will protect mum and baby if a woman is planning to fall pregnant. However, because the vaccine is known as a live vaccine, we do not recommend that it is taken by pregnant women. If you have had the vaccination, we recommend that you use appropriate contraception for 1 month after the vaccine is administered before you go on to fall pregnant.
This probably heard this quite a lot of times, but side effects. Are there any side effects from this vaccine?
Yes, there are side effects to the MMR vaccine. However, they are very minimal compared to the complications of the infection itself. So it can cause the site of the injection to be a little bit red and sore for 2 or 3 days. Around 7 to 11 days after the immunisation, it can cause temperature in children and they may be a little bit unwell. Again, this should only last 2 to 3 days. And we have seen as well about 1 to 3 weeks after the immunisation, some female patients may get painful or stiff joints. Again, this should only really last for 2 or 3 days and be short-lived.
Can I ask you a question about what's inside the vaccine, the ingredients? Are there any ingredients that make it haram?
So in the UK, we have 2 MMR vaccines which work very well. One of them contains pork gelatin. However, we have another vaccine for the MMR which works equally as well that does not contain pork gelatin. It is halal and it is called Priorix, and should you prefer this Priorix vaccine, you should speak to your practice nurse about it.
There are some claims that autism is somehow linked to the MMR vaccine. As a GP, what do you say?
There is no link between the MMR vaccine and autism. In the late 90s, there was some research done by a doctor claiming that there was a link between autism and the MMR vaccination. However, since then, this has been proven to be false. There has been no subsequent research at that time or now that has been able to corroborate any of these claims. So we have no evidence to suggest that there is a link between the two. And so I would say that the MMR vaccine is safe to be administered to our children.
And a bit of a practical question, how can we get the MMR vaccine?
You can get the MMR vaccination by contacting your GP surgery and booking an appointment with your practice nurse. If you have a child at primary or secondary school and they've missed a dose, they may be offered a catch-up dose at school, but you'll be informed about this beforehand. There are also catch-up clinics out in the community, and details for this can be found online. Just remember to take your child's red book with you to the vaccination appointment.
Who can people talk to if they've got questions about the MMR vaccine?
You can book an appointment with your practice nurse at your GP surgery to talk about any questions that you might have about the vaccination, and they'd be very happy to answer any queries or concerns you have.
Dr. Ferduche, thank you so much for your time today. Really appreciate it. Thanks again.